All right. So I'm Sydney and this is Morgan, and we're doing our advocacy presentation um, on the treehouse. So our efforts at the treehouse for our advocacy project. So we aim to disperse $7,000 of funds from a federal grant received to be dedicated towards COVID-19 relief for our clients. Loss of income, childcare, living expenses, medical needs are all the things that this federal grant covers. Some collaborative partners are Uber and Lyft for our families because a lot of them have difficulties with transportation. Local medical providers, so we can pay through this grant, we can pay for doctor's visits, dentists, etc. Local businesses, Jackson Barrow Banks County DFACS, Ida Seeger, who is our Children and Family Services Director. So here's us, and then our supervisor, and then she's supervisor for our supervisor. And then just fellow interns. All of us kind of contributed to doing this this COVID release survey, which we'll get a little bit more into in a second. Transporters and parent educators as well. So we conducted a needs assessment in the form of a survey for our current clients. So it's probably about 20 parents in total. So this is the survey that we distributed. So some of the questions were: has COVID affected any of the following? Employment, access to food, ability to pay monthly bills such as rent, mortgage, water, gas, electricity, car, etc. Access to mental health resources. So can we pay for a counseling? Can we help you get in contact with a counselor, etc. And then I also put in other, just in case there was some that weren't mentioned. And so the rest of the questions are: if you answered yes to COVID affecting your employment opportunities, please explain how in detail. And we did this because our supervisor has to approve the request for the funds to be funded that way, and we have to have a lot of record so we can show that it's going towards COVID relief, not anything else. Okay, so the next one is an actual filled out survey. This is my client who filled this out. So this probably took us about 30 minutes to do together because she has a lot of needs, especially in terms of financial stuff. So she circled yes to having employment opportunities that's been affected by COVID, access to food as well. And so she kind of explained that she lost her job due to having symptoms of COVID, which was like a very good paying job for her, and it worked with her schedule back in November. And now she's working part-time, making less income. And then her access to food. So bringing food to visitation for my son Jace 2 times a week is expensive for her. And so and that has to do with COVID because she lost her job due to COVID symptoms. So it kind of all just trickles down. And then we talked a little bit about her ability to pay monthly bills. So her rent, insurance, clothes, phone bill. She has medication for epilepsy. So yeah, so doctor visits, medication, community resources. Those are all the things that she listed that she needed some help with. Yeah, Morgan, take it away.
So the rationale for why we did the survey was just because it's a way to reach all of our clients and find out the many different ways that they've been affected. And of course, we've learned that through just talking with them and through parent coaching sessions. But the survey specifically gave them a chance to explain some of where their needs are. So like Cindy said, loss of income, housing instability, accessibility to resources all affect their likelihood that they'll get their children back. And because we have the funds, we figured providing our clients with what they need will be beneficial in advancing through their case plan. Okay, so the process was basically we met with our supervisors in our weekly supervision meeting, and they discussed with us that the grant had become available and that they wanted us to figure out how to disperse it. So we formulated the survey and we printed it on paper so that it would be accessible and easy for the clients to reach. And and we gave them to each of our clients whenever they came in for their visit. And then our supervisor reviewed all those responses and made decisions on whether or not their request would be approved and kind of connecting them with the collaborative partners. And so the client that we got to help was the one who needed medicine for her prescription, and we were able to provide 2 months supply of her medication with the funds. Okay, so next are barriers to implementation. So first barrier that we faced was the inability to be direct about how much money was included in the grant, and we think that could have helped encourage the clients more to express their needs and to be um, just more comfortable voicing them and taking the money. Whereas we found that some of them were just kind of confused or guarded or wanted more information than what we could give them, and felt a little uncomfortable. And so, yeah, that was one of the major barriers that we faced. Another one is the time that it takes to process the request for it to be approved and everything. And then the time limit for when the grant can be used. And there's a time limit that has to all be used by the end of 2021. So that is definitely a barrier because we're hoping that a lot of our clients would express their needs. And I don't think as many as we had hoped have done that so far. So, like I was talking about, the outcome is one of our clients being able to get 2 months supplies of her medication, which is really huge, and can really help her have that financial burden lifted. And so the intended outcome is that more clients will receive support from this grant based on their needs until the end of this year. Hopefully every part of the grant will be used towards COVID relief and that we can really utilize the money given. And we hope that in the coming months, more funds will be distributed to the clients that need it the most. Okay, so our discussion questions are, what are needs we could have included on the COVID relief survey? Or like what are other needs we could have included on the COVID relief survey? And then how could we have made this more accommodating or easier to complete for our clients? And that is all for our presentation. Thanks for listening.
Thank you guys.